If you've ever dealt with ongoing back, neck, or joint pain, you know how frustrating it can be to find answers. And today we're talking about how you can get a more personalized approach to orthopedic care. And joining me now is orthopedic surgeon Dr. Jason Thompson with ProLiance Orthopedic Associates. Thank you so much for being here.
Thanks for having me.
Yay! So first of all, what kind of patients are you getting? What injuries do they have?
Well, so in my personal practice, I'm a spine specialist. So it's not always injuries, but the accumulation of life sometimes gets to our spine and our neck. So I usually see people with some combination of neck or back pain that often radiates down their arm or their leg with some nerve pain component.
Oh gosh, okay. And one thing that really stands out though about your office that I think is really cool is that patients don't need a referral to come and see you, right? So how does that kind of change the experience for someone?
Yeah, I think it changes it a lot. First of all, it makes us accessible, so you could just call up today or go on our website and book yourself an appointment. But we also make it so that you can come to our urgent cares or our walk-in clinics, so you can start your care right away with the people who are going to help you and not wait for a referral or wait for insurance authorization. We can get started right away.
That's so helpful when you're in a lot of pain too, to be able to go and see an expert immediately. You also have so many locations. How is that helpful for your physician-led approach?
Yeah, so at ProLiance, being independent and physician-led means we keep all the decision-making close to the care team. So we're not asking the corporate offices what we should do about your care. And we have lots of places embedded in your community, no matter where you live really in Western Washington, where you could drop into a ProLiance facility and get started on your care.
That's nice to have something in every neighborhood so you have your bases covered. Surgery too doesn't always mean a hospital stay, I understand. So how is outpatient surgery centers changing the game for orthopedic care?
Yeah, I think for one, it's much more accessible. Getting into and out of a hospital, even just the parking of it is hard. But we do work with the healthcare systems, and hospital care is really necessary sometimes. But moving things to an ambulatory setting means much more flexibility in scheduling, ease of access, and really a smaller care team, so the care is really personal and really we can replicate it consistently, so we just know you're going to get good care every time with our team.
That's amazing and gives you some peace of mind. And so if someone's in pain and just because they don't need a referral process and all of that, is that the time to just reach out and call you guys and schedule something, or what would you recommend?
Yeah, for sure. We like to see people who are not in crisis, people who might have anticipated that things are getting worse. So anytime you're experiencing this neck or back pain, especially if it's radiating down your arm or your leg, we would love to see you before you're in the emergency room, before you can't go on that vacation you planned, before you can't go see your daughter dance in the evening. So it's really important for people to be proactive in their health care, and by keeping our doors open, we want to make that available to anybody.
Accessibility is everything, and you emphasize finding the root cause, not just treating pain. What does that process really look like?
Yeah, so I think that also speaks to the independent nature of our practice, where we are interested in not just treating your symptom. You can do that just about anywhere. You can do it on your own. But we want to know the why, because once we have an accurate diagnosis, that really informs the best possible treatment. So we want to start with that rather than start with sending you off for some busy work for healthcare. We want to start with figuring out why you have the symptom you have, and then we have a really excellent chance of fixing it for you.
Definitely. Talk about the team too, because I feel like you guys have a really nice, it's physician-led obviously, but a great team approach.
Yeah, I mean, the team approach starts with our interaction with patients on the website or on the telephone. Our front desk folks can get you in, make sure that it's a comfortable, non-threatening experience. We have great medical assistants. And then as physicians, we're supported by great, what we call mid-level providers, so our nurse practitioners, our PAs, and they work directly with us. They work for us and with us and for our patients. So you can guarantee that you're going to get a great experience no matter who you see in the office. But ultimately that decision making, whether you're going to get an MRI or get another x-ray or have your cast change, that comes down to the relationship with the provider.
Yes, and I feel like you touched on this because obviously you have such an amazing team, but what does ProLiance Orthopedic offer that you think just makes you stand out?
Yeah, I think what makes us stand out is that we're not beholden to anybody but our patients. We are there to serve our patients and serve each other as practitioners. We want to all support one another, but it really comes down to that very personal relationship with the patient. So we're not worried about, again, what the corporate office might think about our decision to get an MRI or to have you do some physical therapy or where to do it. We want you to do it where it's convenient for you, for the diagnosis that we've come up with. So I think it's that very direct relationship and the ease of access that makes us very different.
Definitely a patient approach. Thank you so much for your time today.
Thank you.
And for more information, just visit the website that you see right there on your screen, ProLianceOrthopedicAssociates.com.
New Day Northwest is sponsored by ProLiance Orthopedic Associates.